Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is the Oxygen Model of Autism. The Oxygen Model of Autism is a part of my series of oxygen models of various diseases. Models in medicine are proposed to seek simplicities, workable simplicities that allow us to cope with maddening complexities of clinical problems. Models in medicine, of course, like models in physics, theoretical physics, have to be testable and they have to be refutable if the evidence does not hold up. Now, coming back to the Oxygen Model of Autism, Part 1, it simply states that if we examine closely and study deeply all clinical aspects of the autism spectrum, whether we are talking about the causes or the progression or the behavior, biologic course of the disease, prevention or treatment, there is a common denominator, and that is dysfunctional oxygen metabolism, impaired oxygen signaling, impaired oxygen detergent functions, impaired oxygen ATP energy generation, for example, in the brain cells in the context of autism, but also in the bowel and the liver. Now, when you look at the clinical association, for example, whether it is its association with vaccination or the higher risk of autism when the mother during pregnancy has febrile disorders, infections, or when we talk about the children themselves develop these problems after severe infections. And then when you look at the positive experience of integrative physicians, whether they do vitamin B12 therapy, substantial vitamin B12 doses, or vitamin B6 or magnesium, or they look at issues of fermentation in the bowel, gut, and the liver. But the common denominator there again is they're improving the oxygen function. Please look at the other segments of this series on the oxygen model of autism. I present more evidence for it. I offer you some guidelines. My purpose is that what I hear from people, the cause of autism is not known, it's a mystery. Of course, there are no drugs in it, so the neurologists really have nothing to contribute to this problem. But many, many times you see amazing results when you integratively detect and address all relevant issues, including toxic metals like mercury, lead, aluminum, cadmium, nickel. Children's Health Core was funded and founded by Talat, my wife, and I with a mission of providing authentic information for children all over the world on issues of nutrition, environments, and stress, as well as information for the parents, grandparents, and teachers. Please forward this YouTube segment to your email, Facebook, Twitter, LinkedIn contacts. Visit our website www.kids123.org, kids123.org. We have some suggestions and we invite you to participate in this effort, which I think you will find worthy. And please do look at Part 2, Part 3, and Part 4 of the series on the Oxygen Model of Autism. Thank you. Thank you so much.